is now 11 a.m. Mountain Time, so I am going to welcome everyone to our fourth Public Health Disaster Research Award webinar. My name is Megan Morty, and I am a research associate at the Natural Hazard Center. It is one of our core practices at the center to always start and end with gratitude. So I am going to start by thanking all of you for being here today and taking time out of your busy schedules to learn about these new research and application projects. I also want to thank the amazing investigators who you are about to hear from and who have been working so hard over the last year on these projects in close collaboration with community partners who are on the front lines of hazard-affected communities. Your commitment to protecting people in the U.S. territories, rural communities, and tribal nations from disasters is inspiring. Thank you for all that you do. I also want to thank my colleagues at the Natural Hazard Center, starting with our director and co-director, Drs. Lori Peak and Jennifer Tobin. They could not be with us here today, but together they have been the guiding light of this program and are the real force behind its vision that we should do this work with care for the investigators, the research participants, and the knowledge and policy ideas that come out of the research process. I also want to thank my colleague and partner in crime over the last 3 years, Dr. Rachel Adams. Together, we have been administering the Public Health Research Award program. I will spare you all the details, but there are a lot of steps to the process, and Rachel always makes me laugh when it becomes too much. Thank you, Rachel. I also have to thank our research associates and our graduate student research assistants at the center who have served as reviewers and who have provided the investigators with their expertise at numerous points throughout the year. And we could not have done any of this without our amazing publishing team led by Jolie Breeden, our lead editor and science communicator. She is an amazing writer, and working with her every day reminds me why we should all love editors and appreciate all they do to help us communicate better. Thank you, Jolie. I also can't express enough thanks for our amazing undergraduate research assistants, Sappho Teague and Chani Singh, who have been working really, really hard over the last 2 weeks to get the reports and briefs that you're about to hear about online. They have been dealing with a lot of my requests and doing it with so much grace and humor. Thank you both. And Jeffrey Gunderson, who manages the website and comes to the rescue when I mess it up. I am about to pass the baton on to Robin Soler at the CDC, who is going to tell us more about why public health disaster research is so important. And after that, Rachel will explain more about the schedule for today and how we are going to move into the breakout rooms. But first, I want to thank Robin and her colleague at the CDC, Tracy Thomas, for partnering with us and for working with us on so many aspects of this program over the last 4 years. It has been a privilege to learn from you and watch how you support these investigations and this work. Thank you, Robin and Tracy. Okay, Robin, over to you.
Thank you so much. Welcome, everybody. Thank you for joining us today. And thank you. You put me on the spotlight. Thank you.
I'm happy. Yeah.
Somebody's muting me on and off. So thank you to the Natural Hazard Center staff. Megan just mentioned to everybody and their long-term commitment to this program. We're in our 4th year of this program. Special thanks to Tracy Thomas, who has been driving the program and is always behind the scenes, making sure everything works. But she's here today and really grateful to her. We initiated this program 4 years ago. We initiated it for a couple of different reasons. First, because our responsibility is to build the evidence base for public health preparedness and response. And we wanted to be able to do that through kind of some grassroots efforts. Equally important, though, is the science, the base of scientists for public health preparedness and response. We don't have enough in our field. And what we wanted to be able to do was to expand the opportunities with already trained scientists and help them kind of move into the public health space by training them and really thinking about public health impact. So, we were able to do that where many of you all are disaster scientists or other types of psychologists, educational studies folks, anthropologists, etc. And you've been able to really think about your work in the public health space and public health impacts of your work, so that when we do have an emergency, or we're working to recover or prepare for a public health event, we now feel like we have a much broader cadre of folks. I think maybe even 200 new people who can help support this work. And so we've been really thrilled, not just by the work that you all are doing in terms of research and scientists, but by the training that you've done, and the students have been trained as part of this program as well. So thank you so much. I think, as many of you probably know, we are not funding this program next year. It's not because it's not a fantastic program, but our authorization requirements have changed, and we'll now be funding regional centers in the country. We'll be funding 10 regional centers across the country. And so we hope to share more with you about those centers moving forward. With gratitude for all the work that you have done for the past 4 years, hoping that we can continue this program in the future, but it definitely is on pause for next year. So we're really looking forward to your presentations. We know we're really short on time, so let's get the party started. Thank you.
Thank you so much, Robin. Okay, so today we will be hosting our final webinar. And just to say hello, for those of you who don't know me, I'm Rachel Adams, and I'm a research associate at the Natural Hazard Center and the co-lead administrator of the Public Health Disaster Research Award Program, along with Megan Morty, who heard from first. And during today's webinar, we will be hearing from the recipients of Special Call 4 and our Continuation Award 2. And Call 4 supported interdisciplinary research on public health preparedness and response to disasters in U.S. territories, rural areas, and tribal communities. And the focus of this award was on community-based research that involves local collaborators with important implications for health equity and public health practice and policy. And these projects covered a number of very important topics, including 911 calls during extreme temperature and poor air quality events in Montana, social vulnerability of refugees to climate disasters in the Texas Panhandle, the recovery of children and families following the 2020 Slater fire in rural Northern California, the compounding effects of disasters and confinement on the mental health of incarcerated women in rural Texas, and the mapping of social vulnerability of farm worker communities in North Central Florida. So copies of these reports can be found in the link provided in the chat. So Megan, you can drop that in. Thank you for doing that. So for the Continuation Award 2, which was open to recipients of our past special calls, we supported 2 tracks, one that focused on expanding data collection and analysis of the original research, and another on expanding community engagement to spread knowledge, build connections, and encourage application and implementation of research findings. These projects focused on risk communication practices at municipal levels in Puerto Rico, designing a resilience hub plan with the Upper Mattaponi Indian Tribe and the Mattaponi Indian Tribe and Reservation in Virginia, evaluating post-disaster student programs and services in Puerto Rico, validating the disaster food security scale and for rural communities, and implementing a community-based participatory budgeting intervention to promote resilience to recurring hazards in Puerto Rico. So again, copies of these reports can be found in the link provided, as well as copies of the engagement briefs for those who took part in track 2 of our Continuation Award. If Megan, if you can put the, the link to that as well. So without further delay, it's now time to hear from you all, the researchers. And so we are going to separate out into 2 breakout rooms. So I'm going to open up these rooms right now. And so when prompted in Zoom, you will have the ability to enter one of 2 rooms. It will either be Call 4 or Continuation Award 2. So please just make sure to add yourself when prompted. So welcome to all of you. We're so excited to hear about your projects. I know I was very involved in the beginning, and then I left for leave. So I'm all just playing catch up now and learning about all the great work that you did while I was gone. And so really today it's just about hearing from you. Each of the teams will have 12 minutes to present. And then we'll hold all of the Q&A and wrap up for the last 10 minutes. So you'll have an opportunity to ask questions of your colleagues here. And so we are great on time. So why don't we start off from hearing from our first group, sorry, the social vulnerability of farm worker communities in North Central Florida, challenges and opportunities for mapping vulnerable populations.
Great, thank you so much. I'll go ahead and share my screen.
And I do apologize in advance, just to keep everyone on time. I will be interrupting at the 12-minute mark so we can have everyone present.
Great. All right, are you all able to see the slides? Wonderful. All right. Hi, everybody. My name is Miranda Carver-Martin, and I am honored to be presenting for our team. I do want to acknowledge my co-presenters, Paul Monahan and Amar Abdurrahman at the University of Florida, Robin Louie at the Rural Women's Health Project, Jeannie Economos, Anessa Ruiz, and Dominique O'Connor at the Farm Worker Association of Florida. And what I'll be talking to you today about is a project that aimed to understand the social vulnerability of farm worker communities in the North Central Florida area. And when I say farm workers, I'm not talking about the owners of agricultural operations, but rather hired laborers who are doing largely manual tasks such as planting or harvesting. And within the United States, many of these folks are from Mexico and Central America, but also elsewhere in the world. For example, in Florida, there are many Haitian farm workers as well. So it's a very diverse group, and they have unique disaster experiences that are very important to understand in order to better serve them. And when I say social vulnerability, I'm referring to the idea that one's life circumstances make it harder to prepare for and recover from a hurricane, such as, for example, if you're unable to access essential alerts or information about resources in a language that you use. And we focus on the North Central Florida area that's depicted in this visual here. And what this visual also shows is that the area that we focused on is a little bit less agriculturally intensive than the South Central area, but nevertheless has quite a few farm worker communities and agricultural lands as well. I will also note that the visuals and the quotes are going to be available in the publicly accessible report that's on the Natural Hazard Center website, and many quotes are included in the appendix if you want to learn more about the stories that are underlying what I'll be presenting today. I will be flying through a lot of this stuff, so if you do want to learn more, I encourage you to check that out as well. So this study, we sought to build upon an existing tool that's provided by the CDC, measuring and visualizing social vulnerability scores meant to highlight particular areas where social vulnerability is thought to be particularly high that might need additional influx of resources or particular services tailored to those communities. And we wanted to expand that tool to reflect the unique vulnerabilities of the agricultural worker population, knowing that many of their experiences are not captured in that current tool. And we also wanted to provide specific and place-based information to local service providers to better support these communities. And we focus, as I mentioned, on the North Central Florida area and have been working on this project since November of 2023. This is in the aftermath of Hurricane Idalia, which made landfall in the Big Bend area of Florida on August 30 of last year. The research questions that we asked for this project were, what factors shape the vulnerability of farm worker households to major storms? And as we'll see, there are several that are included in the CDC Social Vulnerability Index, or SVI as I'll refer to it, and many that aren't being measured that are describing individual farm worker households. But we also found that it's important to include factors reflecting the community, how well or poorly the community overall is providing for the safety of all its members. The second research question was, can this vulnerability be mapped using existing data resources? The short answer to this is no, not with the data infrastructure as it currently is. However, in response to research question number 3, how can agencies and organizations account for this vulnerability in disaster preparedness and response planning? We explored some ways where maps alongside stories of people's experiences can be used to help tailor specific services to the realities that people are experiencing. A quick note about methods. We convened 2 community advisory boards who served as both advisors and actually provided some qualitative data that we analyzed and included in our analyses. We spoke with farm worker serving staff who live alongside farm workers and work with them directly to connect them to services and supports, as well as data stakeholders, folks in public health departments, municipal government, and agricultural extension. And the first community advisory board was held in Spanish, and the second was held in English. We also had more in-depth conversations with folks who work directly with farm worker communities and did a more in-depth analysis of those data as well. And we integrated that with a geospatial analysis of selected data sets and variables. The first finding that I want to highlight is that assessing social vulnerability requires understanding the local context. As much as I would love to say we created a scalable tool that's going to be applicable to anywhere in the US where farm worker populations are living, that's unfortunately not possible, just because context matters, and the same person may face different kinds of challenges in different places. And so we found it important to tailor and incorporate different variables to reflect different lived experiences. On the left, in one of the left columns, are a list of indicators that are included in the CDC SVI that we did find relevant to the experiences of farm worker communities in North Central Florida, especially housing cost burden, low educational attainment, limited English proficiency, living in mobile homes, and not having access to a personal vehicle. But we also found a lot of gaps and factors that were very important but weren't captured in that tool, especially job precarity, living in the country for a short time, limited hurricane knowledge or experience. For example, if you're from part of the world that doesn't get hurricanes, you may not know how to prepare or what resources might be available to help you recover. Also, people with diverse legal statuses, so in process, undocumented, or mixed status, have been denied services, denied access to basic human needs of food, water, shelter, on the basis of their legal status, or maybe not having a social security number or something like that. And then also living in substandard housing conditions. And all of these factors that I've just mentioned are specific to particular households. We also found it important to include factors that describe the community overall, and really get at the root causes of the social vulnerability. For example, having limited English proficiency or limited Spanish proficiency is only a problem if you're not being provided key information in the language or languages that you speak. And so incorporating factors such as, our emergency management communications being provided only in English, that would be an indicator of social vulnerability within the area. Also looking at anti-immigrant policies, which contribute to a culture of fear that contact with public agencies or individuals that might be seeking to provide services, or even just reaching out to access essential shelter and other resources, people are afraid to do so because they're afraid of a negative consequence from those interactions. We did find in the context of these major gaps that became clear to us in our conversations, farm workers serving organizations, churches, and social networks navigate those major gaps. And this quote here on a slide is from a community health worker who described how school shelters and schools filled up, but there was still a family that needed to access shelter. And so she was able to use her personal contacts and word of mouth to find shelter within a church for this family. I also mentioned that we explored integrating geospatial data and mapping with qualitative data and stories of people's experiences. And this is one example. The mobile homes indicator, this is one of the variables that's actually publicly accessible within the CDC SDI data set. And we've overlaid on this indicator agricultural lands within Florida. And what this shows is both the high prevalence of living in mobile homes within our study area, but also the intersection of agricultural lands with high prevalence of mobile homes. And it really emphasizes the need for designing interventions designed to serve these populations in particular. But even more than just understanding that people are living in mobile homes is it's important to understand their specific lived experiences that can increase their risk during a disaster scenario. So, for example, many people were afraid to leave their homes to seek shelter or stronger structures because they felt that, or they feared that they wouldn't be accepted because they didn't have documentation or identification, or that they wouldn't be able to speak the language, their own language, if they accessed a resource that was only being provided in English, for example. And so when interventions are being designed for farm workers living in mobile homes, it will need to be to account for these concerns and provide services in a way that's going to be safe and comfortable for people to feel that they can access the supports that they need. In addition, we find that it's important to understand the existing community assets that could potentially be leveraged to better support farm worker communities. This is a map of the average distance to schools within the census tract, which also has agricultural lands. And so we think that this might be a way that we can target particular areas for specific interventions. So areas where the average distance to schools is lower, and also there is a high proportion of agricultural lands, those might be areas where school-based interventions could be targeted. So making sure that the schools are providing communications in languages other than English, and being responsive to the languages that their communities speak, maybe citing services at school facilities. But also, it also highlights areas where a different approach may be useful, such as supporting farm worker serving communities, or farm worker serving churches, and churches that have Spanish language services, to help fill some of those gaps when schools might be a little farther away. So there are 3 public health implications that I want to highlight very quickly. One is that long-term, we need to move toward measuring the root causes of social vulnerability at the community level, in addition to including factors kind of descriptive of individuals' life circumstances, but doing so will increase accountability for public agencies to serve all of the community members and also monitor improvements over time. Short term, we can do exercises like I showed on some previous slides of integrating experiential stories with geospatial data to tailor place-based intervention strategies that reflect people's lived realities. And finally, in order to achieve these short and long-term goals, farm worker serving organizations and practitioners need to be at the table in disaster planning, both because they can communicate the barriers that farm worker communities are facing, as well as use their deep place-based knowledge and linguistic and cultural competencies to communicate essential information back to the communities about how to prepare and how to access resources that they need following a disaster. And they should be compensated for these essential contributions so that we can really make real progress toward addressing the structural root causes of social vulnerability. And finally, I have very many people to thank, but time is running short. So I just encourage you all to check out the acknowledgements section of the available report for a list of the incredible folks who contributed to this work. And thank you so much for your time and attention.
Thank you so much, Miranda. That was excellent.
Thank you.
Again, just removing the pin there. All right, so we'll now be hearing from our next presentation, Enhancing Disaster Resilience and Supports for Oh, my mistake. Sorry, I was looking at the wrong thing. That's in the continuation word. Sorry, next we will be hearing from social vulnerability of refugees to climate disasters in the Texas Panhandle.
Well, good afternoon. It's a great pleasure to be here to share our research project with you. Now, let me share my screen with you. Oh, one hold. Yes, it's a great pleasure to have the chance to share our research project with you. This is a project my co-author Ming Xie and I have been working on over the past year. My co-author, Dr. Ming Xie, right now is on her way to heading over to the University of Maryland. She is driving from Texas to Maryland today. So I am giving the presentation today. In short, we did a survey study to examine refugees' public health risks and their resilience to climate-related disasters. And since our study population live in the Texas Panhandle, most of the areas are rural communities. We emphasize their vulnerability in the rural areas. So our purpose, the study has three major purposes. First, we wanted to examine those refugees' current levels of social vulnerability, in particular in response to disasters. Their current level of social vulnerability is mainly, in this study, is mainly demonstrated as some social demographic variables. And second, we wanted to identify the social determinants of health that predict refugees' health communication activities. Health communication activities mainly encompass refugees' information-seeking activities and their accidental exposure to health information in the media. And the last research question is the most important research question. We wanted to examine the factors that shape refugees' perceptions of health risks caused by climate-related disasters. To what extent they think they are susceptible to those health risks caused by climate-related disasters, and to what extent are they prepared? These are the things we wanted to learn about. The research site is the Texas Panhandle. If you're not familiar with Texas, this part is the Texas Panhandle. If we view Texas as a pen, and this part is like the panhandle. So most of these areas are rural areas. The biggest city is Amarillo. Amarillo is like here. A large number of refugees reside in the Texas Panhandle. Many of them have formed stable communities. They have been there for decades, so they have formed some good communities, while others have not. Some refugees, some ethnic groups have not formed good ethnic communities, so they are more like scattered at different places. In short, we surveyed refugees from a variety of countries and cultural origins to answer our research questions. We began to collect survey data in December last year, and in this report, we said we finished data collection by May 2024. In fact, last month we collected a few additional survey responses, but we did not have time to add the last 30 survey responses to our data set. I took a quick look at our data set. Adding the new 30 survey responses does not change our research findings, but it only increased the number of participants. So the research findings here are still applicable to the larger population. So these are the three research questions we wanted to answer. They resonate with the three research purposes I mentioned just now: refugees' current level of social vulnerability, social determinants of health, and how their social determinants of health affect their perceptions of the health risks caused by climate-related disasters. We distributed a paper and pencil survey to collect our survey responses. Refugees are a hard to reach population. It's not very likely to rely on online crowdsourcing platforms such as Mturk or Qualtrics to find them. Not many of them are online. They use the internet a lot, but very few of them would would register themselves on those survey platforms. So there was no way we could find them online. As a result, we used the old school method, but it was effective. We distributed paper and pencil survey questionnaires at the end of the cultural orientation workshops. We hosted it at a few refugee serving organizations in the Texas Panhandle. We did it this way. In fact, my co-author and I have established good relationships with a few refugee serving organizations in Amarillo, such as the Catholic Charities and the Refugee Services of Texas. So we have been constantly offering cultural orientation workshops at those organizations. Once every 2 weeks, a different group of refugees attend those workshops. So even if we had never had a chance to conduct this research study, we would conduct those cultural orientation workshops. So at the end of each cultural orientation workshop, we asked participants to complete our survey. In this way, we collected our survey responses. And all these participants received a Walmart gift card in the amount of $5 with the completion of the survey questionnaire. This is how we collected our survey responses. By the time we wrote this report, we collected 177 responses. But in fact, as of today, we have collected more than 200 responses. Overall, the average age is about 37 years old, and their level of English proficiency is relatively low. On a scale of 1 to 10, 10 means very sufficient in English. 1 is not able to speak English at all. Their score is 3.88. And by the way, I forgot to mention this on the previous slide. Since most participants, in fact, most participants had a low level of English proficiency, we translated our survey questionnaire into the different languages they spoke. So we have different language versions. And here's another visual illustration of our sample. Somewhat surprisingly, more than 50% of our participants are from Cuba. This is interesting because according to the staff members at the Catholic Charities, they had a large number of Cuban refugees over the past year. As a result, many of them attended our workshops, and as a result, many of them completed our sample size. In fact, at the local level, not like 50% of the refugees are from Cuba. No, the percentage of Cuban refugees is much lower. In fact, we had participants from a wide variety of countries, from Myanmar, Thailand, Mexico, Afghanistan, Congo, and so on and so forth. So these are our research findings. First of all, we wanted to know about their current levels of social vulnerability in response to those health risks caused by climate-related disasters. Our brief conclusion is, yes, the survey data show a significant socioeconomic disadvantage of refugees. Well, in what ways? First, look at their household income. Their average household income is relatively low, much lower than the average of Amarillo residents. And second, and of more importance, as you could see, more than 50% of them are not employed. So this is a big problem. Being unemployed could lead to even more vulnerability. And even if many of them had full-time job, based on our knowledge about them, most of them worked at a meat packing plant, Tyson, somewhere in Amarillo. It's not a good workplace either. So their employment status was not very good. And in addition, they had very low risk and awareness of climate-related disasters. So when we asked them, are you likely to encounter any climate-related disasters? So many of them said, no, I don't know. I've never thought about this. And they do not even know what disaster truly means. And some people said, well, to me, the biggest disaster is receiving a medical bill. So they do not know the natural disasters we are talking about. In short, this means they have a very low level of perceived risk and awareness of disasters. And this means we need to raise their awareness because they face a lot of risks, but they are not aware of them. That's a big problem we need to address. And second, we also felt that those refugees were very uncertain about the future. They do not know what kinds of disasters they are likely to encounter, and they do not know what kinds of health risks those disasters would bring about. They are just unsure. They are uncertain about everything. So this is two major findings to answer research question number 1. And second, we wanted to know how their social determinants of health influence refugees' exposure to information about the health risks caused by climate-related disasters. In short, we found that their level of exposure to all types of information sources is very low. In fact, they do not actively seek or read or encounter any news information related to disasters. They just don't pay attention to those information. They don't like it. They are not aware of those issues. And they also have a low level of information seeking and scanning activities across all types of information sources. They spend a lot of time online and they spend a lot of time using social media, but they have never actively sought any information related to disasters. This is something they don't care about at all. And of more importance, they are not able to record any moments when they accidentally encountered any information about disasters. Like, they cannot remember if they have ever received any warnings or alerts from their from any apps. In fact, many apps push forward those kinds of alerts, but they do not remember any situations when they noticed those alerts. So they are, in short, they are not exposed to sufficient information about disasters or the health risks caused by those disasters. And finally, what about their level of disaster preparedness? Overall, their level of disaster preparedness is very low. As I mentioned earlier today, they are not even aware of those disasters. So how could they get prepared? Now they know nothing they could do. And many participants said, well, even if a disaster happens, I just wait and see what happens. I am able to survive it. They are confident. They believe they are able to survive those disasters, but they have never done anything to prepare for those disasters. So they just mentally, they just think they are able to survive it. And with regard to specific social demographic variables or social determinants of health, we found something. This is very interesting. Overall, older age, being male, lower income, better housing status, and more active involvement in social groups predicted higher perceived susceptibility to the health risks caused by climate-related disasters. So those older people, males, lower income, better housing status, and those who were more actively involved in social groups were more likely to think that they were likely to be affected by climate-related disasters. In other words, their disaster awareness was relatively lower. So some of these findings are consistent with existing literature, but this one, males were more likely to think they were susceptible to those disasters than females. This is somewhat against existing literature. Most existing literature predicts that females believe that they are more likely to be affected by disasters. So I think this is an interesting finding. Yeah.
Sorry to interrupt. I just want to let you know that you have 1 more minute.
1 more minute. So this is, one possible explanation is the refugee populations, those communities are slightly different from those local communities. Those males are more likely to work at dangerous places. As a result, they think they are more susceptible to those risks. So some implications. First, we think we have to focus on refugees' economic stability, provide language support, and offer more educational initiatives to help them alleviate the barriers that prohibit them from preparing for disasters. And second, I think educational programs, especially those community outreach programs, are likely to be the most effective to train them are likely to prepare refugees for all kinds of risks and disasters. And also, we would encourage those public health experts and professionals to develop some to focus more on the media communication channels that refugees trust, develop some apps that could disseminate reliable risk and disaster preparedness information to them. And finally, we also find that those who live in good neighborhoods were more likely to think they are able to cope with the health risks caused by disasters. So this means community-based interventions are likely to be helpful too. And regarding policy implications, we believe that refugees have some unique needs, and their situations are not always consistent with existing literature. So their voices should be included in policy making. And finally, we would like to acknowledge every refugee who has participated in our survey study. And also we would like to appreciate the following organizations: the Catholic Charities of the Texas Panhandle, the Amarillo Chain Church, Amarillo, the other church is for the Korean church, and also Samantha, Samuel, and Biak for helping us with data collection and survey translation, and also connecting us with local refugee populations. Thank you very, very much for your attention. Yeah, yes, thank you very much. It's a great pleasure to be here. Oops, I'm sorry what I'm doing. Yes. Should I stop share? Yes.
Yes, thank you so much for that wonderful presentation and for all the work that you're doing. Next, we will be hearing from the public health implications of 911 calls during heat and smoke events.
Great, thank you so much. I'm just going to, like everybody else, say I'm going to share my screen here. And all right, thanks so much for being here today. My name is Christina Barsky. I lost the coin toss. I am here representing a large and diverse group of researchers that were essential to making this project happen. So here you'll see on the screen myself, my colleagues Lauren McKegg, Blake Emity, Mesa Walters, Adrian Beck, and Damian Chase Begay. We were interested in figuring out how best to be of service to our community in Missoula, Montana. If you're not familiar with the area, on the map there, we're far northwest at the edge of Montana and Idaho. And here's a screenshot I just took about heat, which is coming back to our community. When the call for this award came out, we reached out to our partners at the county and asked what would be beneficial. And more, we heard from both our Office of Emergency Management and City County Public Health that understanding if the hunch that during heat and smoke events that 911 calls were originating from specific geographies was true, and if so, which geographies, so we could take a look at designing pre-exposure intervention and mitigation strategies. So our purpose of this project is to produce information supporting our county public health disaster planning and response, adaptive management strategies, and increase the equity in public health outcomes during heat and smoke events. Our research site, like I mentioned, is Missoula County, Montana, home to the University of Montana in the city of Missoula, which is the only incorporated city and community in the county. The grade period, as you know, was from November 23 to May 24, and our analysis period was January through October of 2020, were the timeline that we were looking at for this. Our research questions that were guiding this project included these three on the screen. The first, is there an association between 911 calls, geography, and climate events in Missoula County, Montana? Originally, we started looking at temperature, both heat and cooler weather, and air quality events in terms of particulate matter 2.5 in the air, primarily in terms of wildfire smoke. Our second research question was asking if during poor air quality and temperature events, which geographic locations are most vulnerable to disparate health outcomes as indicated by 911 call frequency. Simply, when it's hot or smoky, are there certain areas that may be experiencing the health outcomes worse in terms of needing to call 911? And then we were interested in understanding where pre-disaster preparedness planning should be directed to advance equitable public health outcomes. To address these questions, we undertook a secondary analysis of existing data. We collected data from Missoula County Office of Emergency Management. This is the 911 calls. In Missoula County, there are between 110 and 120,000 calls a year. We worked with our partners at the Center for Population Health Research at the University of Montana, which helped us get our hands on heat and air quality data. And finally, we use the American Community Survey data to look at a variety of demographic and social characteristics at the census block group level. So we grouped our data at that block group level and looked at our dependent variable, the average daily 911 calls in Missoula County per day per census block group. And then our independent variables looking at average mean temperature, average daily 2.5 particulate matter, and demographic characteristics. We undertook this study by both completing statistical analysis using Stata and geospatial analysis in ArcGIS. Demographic variables that we looked at were informed by the literature and what we know about disparate impacts from temperature and poor air quality. We looked at the percent of census block groups that were not white, percent of households receiving public assistance, average income, educational level, households with annual incomes under 50,000, unemployed, and those over the age of 65. I do want to mention that we created two versions of our dependent variable. First, the average 911 calls per day per census block group, but this could be result in the fact that more 911 calls might come from a census block group that has more people. And looking at Missoula County, block groups had a pretty diverse population ranging from a low end to a high end. We wanted to normalize. And so we normalized a number for each census block group for 911 calls per 1,000 people. So we're comparing sort of apples to apples. So preliminary findings include that demographic factors that are most strongly associated with higher numbers of 911 calls across all block groups include the percent of households that are occupied by renters and the percent of households with annual income under $50,000. So to put this another way, in the census block groups that have more people that are renters, we see more 911 calls. In summer months, as temperatures rise, so too do 911 calls. In census block groups. And in fact, the effect of temperature on the number of 911 calls was stronger than any other characteristic or demographic indicator that we considered in this study. Importantly, for each degree Celsius that the mean daily temperature increased, the frequency of 911 calls also increased by 1%. So that might not sound like a lot, but I want to share with you a little sort of back of the envelope math that I did the other day when talking with a reporter about the heat wave that has been affecting the Western United States for the month of July. So if we looked at sort of the first preliminary days of the heat wave, we saw that mean daily temperatures in Missoula County in 2024 were 5.2 degrees Celsius above the average that we saw in 2020. And if that held for the whole month, we would see 520 more calls in that month than we would have had the temperature maintained the average in 2020. Or that we would see almost 17 more calls per day in Missoula County as a result of this heat wave. So we're seeing real-time implications for this preliminary finding. Next, we see that higher temperatures increase 911 call frequency more severely in certain block groups. This is sort of what we would expect, right? Geography matters and who lives in certain places matters. We know that residents who are unemployed or not in the labor force, and those that are over the age of 65, the communities where these individuals live have a higher propensity of 911 calls during hot days. Surprisingly to us, we found that particulate matter 2.5 did not have any statistically significant association with 911 call frequency during our study year, which I'll just remind you was 2020 in Missoula County. It's important to note that that was also not a year that we had severe wildfires. And so as we continue this research moving forward, both in terms of the number of years that we'll be analyzing, we're interested in seeing whether years that have particularly worse wildfire seasons in the West will impact this finding. So we anticipate it changing, but for the sake of this presentation, we're only talking about 2020 in Missoula County. Moving on to public health implications. We think that there are several that are important to identify here. The first is that emergency managers and public health professionals can predict to some extent where 911 calls will originate and which groups may need help during heat events. The impetus for this project originating at the county level was to be able to plan for pre-heat and smoke interventions, whether that was figuring out where clean indoor airspace could be, where we need to place cooling shelters, or how to deploy community medical professionals for door-to-door checking in on individuals. So we hope that the implication of this, so far, this research is that the emergency managers and public health professionals will be able to better target interventions in the future. Next, we believe that understanding the geographic and population demographics in this area, that public health and emergency management officials can better anticipate and allocate resources during heat events. We know that we don't have an unlimited amount of resources to tap into to make sure that individuals in our communities are being served. And so how can we prioritize ensuring that resources are dispatched to those areas and communities and individuals that are most vulnerable? Third, beyond response, beyond being able to reach out when the heat wave is here, we hope that leveraging these data is that public policymakers can build future prediction models and pre-event mitigation strategies to help people over 65 and those out of the workforce to make sure they don't suffer adverse health impacts from high heat events. We're seeing in Missoula County, this is already taking form in a couple of different ways. The screenshots that I've shared throughout this slideshow are from the outreach that's being done in the most recent heat wave during July in the West. And excitingly, our partners in this work and in the community have released a new extreme heat toolkit for Missoula County that we hope this research will funnel into in terms of policymaking in the future. In addition to the folks that have been thanked on this call, the Natural Hazard Center and the CDC, we also would like to thank the University of Montana Center for Population Health Research, our Office of Emergency Management, and Missoula City County Public Health for their assistance in this work, and to my several co-authors and partners in this work in the community. I'm a little bit under time, but I hope that that gives you a taste of what we have been working on in Missoula. Thanks so much.
Thank you so much, Christina. That was excellent. Okay, so now moving on to our next presentation, How Rural Contexts Shape Disaster Recovery, Children and Families After the 2020 Slater Fire.
Hi, thank you. Give me just a second to share my screen here. Okay. Are you all able to see the presentation?
Yes.
Fantastic. Okay, thank you. I'm really excited to be able to be here and present on behalf of my group, Rita Burke, Santina Contreras, Abigail Yeager, and Jasmine Borgatti. And I'm going to be talking a little bit about the factors that are associated with recovery and resilience after wildfires, specifically for rural families. So the purpose of our study was to really better understand what the factors are that contribute to rural communities as either barriers to recovery or contribute to their overall resilience with regards to wildfire. We focused our research on Happy Camp, California, which is a rural community in the Klamath National Forest. There's roughly about 800 people that are residing there, and they're very isolated. The nearest incorporated city is about an hour and a half away. And in September of 2020, the Slater Fire really devastated Happy Camp. It burned over 150,000 acres and destroyed 212 homes, which is the equivalent of about 40% of their housing inventory. The fire was declared contained on November 16th, and now Happy Camp is entering or nearing their 4th year of recovery. So the research questions that we wanted to look at as part of this work are, first, what are the drivers to recovery and resilience in both the children and families that survived the Slater Fire in a small rural community? And then also, what are the barriers for that same subgroup? We wanted to get a better understanding of what makes these rural communities unique in terms of their needs and strengths. And then also we wanted to look at what is the role that schools and other community-based infrastructure plays in the recovery with regards to Slater Fire. So for our methods, we did a mixed method data collection consisting of focus groups, one-on-one interviews, and peer interview, pre-interview questionnaires. So we developed focus group guides and interview guides with our community partners, and our focus groups were for residents of Happy Camp. We conducted separate focus groups for both adults and children. The children that participated in our focus groups were ages 11 and up, so they were at least 8 years old when the Slater fire occurred. We also did 10 interviews with community organizations that provided both immediate and long-term support services after Slater fire, like the Happy Camp Community Action and the Carrick Tribe. And we interviewed individuals from other response agencies that played a role in recovery. For example, the Northern Valley Catholic Social Services and Hope Crisis Response Network. And some of our preliminary findings, excuse me, some of our preliminary findings with regards to the needs of rural families in disaster recovery, first of all, was that rural culture really needs to be understood in order to effectively support these communities in recovery. We talk a lot about cultural competency when we're addressing various ethnic groups and language needs, but what we learned is that Happy Camp is really a tight-knit community, and it's developed its own values, beliefs, and essentially a culture of its own. And one of the residents even says, I describe my connection to Happy Camp sort of like gravity, like a pull. It feels like it pulls you back. It's hard to leave and stay left. Even if you're not living here, your heart is still here. So that's really how I would describe it, like gravity. And we saw this theme of cultural needs come up with regards to relocation. As you can see from the quote here, the residents are really passionate about staying in Happy Camp. And when they were told that they needed to leave and relocate elsewhere, most of them didn't want to. Happy Camp is their home, it's their community, and for many of them, it's part of their identity. And we also saw this manifest in other areas as well, especially with regards to the fact that local community partners were so integral to recovery. One great example of this is that the Carrick Tribe there was able to secure temporary trailers so that they could accommodate housing for people that were wishing to stay in Happy Camp during the recovery rather than relocate. We also saw with the social workers that came in to help, we had 2 social workers during the time of the recovery. One of them was local and one of them was non-local, and the residents specifically waited to work with the local resource because that person was known, trusted, and understood their needs and their culture. Talking a little bit about what we saw in the children, some of the parents during our focus groups noted that they had seen their child exhibiting some post-disaster behaviors after the fire. This could look like their child expressing that they were stressed anytime they smelled smoke of any kind. Others stated that they saw their children packing at the beginning of the season, beginning of fire season, in case they had to leave again. We also saw that the children are really still processing their experiences when they return to the classroom. One of the students shared that, quote, going back to school was kind of horrible because you have to do math while it's all smoke outside and you can't go outside, and there's houses that were burned down and you just had to sit there in a desk doing math. So while they're in the classroom, the students and children that we spoke with shared with us that they're thinking about their experience. They're thinking about maybe pets that they had lost, or they're feeling uncomfortable because they're re-wearing whatever limited clothes they might have after the fire. So even though they're back in the school setting, they're still working through their experiences when they return to school, and they need to be met with a supportive environment. What we had theorized about schools initially was that the schools would be really a pillar for the community during the recovery, but what we ended up finding was that schools need adequate support and funding prior to disasters in order to contribute to that community resilience. The residents noted to us that the school was already challenged with staffing prior to Slater fire, and then these challenges were just exacerbated afterwards. One of the residents said, "No offense to anybody in the school system, but our schools don't have any support at all whatsoever." The school struggled to get credentialed teachers to come in, which resulted in classes being led by aides. And this is happening at the same time that the students may be needing extra support in the classroom as well, all while the school system itself is experiencing its own challenges. And this was really driven by lack of housing because so much of the housing inventory was lost and there's no commutable towns close by. Recruiting staff is challenging because there was nowhere for them to live. And in addition to this, many of the staff were also displaced after Slater Fire. So in order to get the school up and running again, a number of them moved into trailers on the school parking lot, where one resident shared that that's what the principal of the elementary school is doing right now, living on school grounds. So it's important to acknowledge that these educators are also experiencing their own losses and have a need to kind of have recovery time and recovery support as well. Which leads me to some of our public health implications. The first one that I want to draw attention to is that cultural competency really is something that needs to be considered when working with rural communities. And Happy Camp is a great example of this because they're isolated and generally an independent community. And we experienced both from our focus groups and interviews that there was a hesitation and mistrust in working with some of the external recovery support partners. So it's important when supporting these communities that time is taken to understand their values and experiences and tailor response efforts in order to best support them. Also, the second public health implication is that supporting rural community resources can help to build resilience. Happy Camp has a number of community resources that contributed heavily to their recovery. The Karuk tribe being one of them, who was integral in providing immediate housing after the disaster. There's also the Happy Camp Community Center, which is pictured here. And this really is a hub for the community and continues to be a place for residents to connect with one another, as well as it's a first point of contact for those with recovery needs. And we also saw this with the schools in Happy Camp, that with better funding and support, they could be that beacon of resilience. So supporting resilience in these communities can really look like supporting the existing community infrastructure itself. And then finally, that children may need support at school in order to continue processing their experiences. We know that the school provides a sense of routine and normalcy, but beyond that, these children are still working through the experiences that they faced. So in addition to academia, there's an opportunity for schools to provide recovery support. And there's more to consider here with what the balance may look like between administering academic services, but also post-disaster services. And there's a potential value of school-based disaster support programming. I want to take a minute to just give our acknowledgements. We're extremely grateful to our community partners, Abigail Yeager and Jasmine Borgatti. Without them, this work would not have been possible at all because they really were our welcomers into the community and really helped make all of this happen. And we're also extremely grateful to the community of Happy Camp as a whole for really just welcoming us and being so vulnerable and sharing their experiences. And we hope that we were able to do some of that justice. So thank you all for your time, and I appreciate the opportunity to present this sample of our work to you.
Thank you so much, Amber. That was very interesting. Amazing work that you're doing. Okay, and now we have our final presentation, the compounding effects of disasters and confinement on the mental health of incarcerated women.
Thank you. I'm going to go ahead and share my screen, and then I'm going to let Jennifer Toon start, and then I will pick up with the presentation.
Great.
Okay.
Cool. Hey, everybody. I'm so excited to be here today with Benika. Our study is about the compounding effects of disasters and confinement on the mental health of incarcerated women. My name is Jennifer Toon. I'm the project director for Lioness Justice Impacted Women's Alliance, and you'll see here all the names of our team members, Dr. Dixon and Dr. Purdom. Tara, Takira, and Sela were also incredible partners on this team. So, next slide. So, as formerly incarcerated women and gender expansive people, we really started to think about the disasters that we faced, that we felt like really challenged our mental health in a very unique way that we don't hear formerly incarcerated men talk about. And as the community partner org in this project, we got to know Benika and Carly through some of their previous research on the dangerous temperatures inside of our Texas prisons, and developed a really great rapport. And so we got together and we talked about, what would it look like to be able to look at the public health implications of specific ways that disasters affect women. And so the purpose of the study was to address and better understand incarcerated women and other gender minorities' experiences with evacuation efforts and related decisions in disasters. So the sites that we picked were Bryan College Station in Texas, Weatherford, which is in the DFW area near Dallas, Fort Worth, Austin, and then we decided for our last one to do a virtual remote focus group. We decided that we were going to do this through focus groups. And so we wanted to make sure that we had a virtual option. Texas is a big state, so we wanted to make sure that everybody had an opportunity to be a part of that. So you'll see down here our timeline. We had our first focus group in February, late February in Bryan. Then the 1st of March, we went to Weatherford, the end of March in Austin, and then again, remote through Zoom at the end of April. Next slide. So here were our research questions. And I really love, I can't talk enough about the folks at Texas A&M. They've become incredible research partners and friends and allies. And the process of working together to come up with the research questions really centered our lived experience in a way that other researchers or other folks working with us have never done before. So here were the questions that we all came together and decided on. How do incarcerated women and other gender minorities in women's prisons experience disasters? How do incarcerated women and other gender minorities disasters experiences impact their health? What role do carceral processes, policies, culture, and environment play in shaping hazard risk in prison context? And how do incarcerated women and other gender minorities cope with disasters? Next slide. So our methods were pretty cool. So all the aspects of the study were co-developed by the A&M faculty and students and our Linus membership, our leadership. So we were able to, as the community partner, recruit the participants in the study. There's a rapport and a trust among us that, we were able to find people to participate. The focus groups were led by us. We also had an actual peer support specialist. There is Chanel Jones was our peer support in those focus groups. So oftentimes what has really felt lacking for us in research projects is that you're handed a piece of paper, after, talking about some really, really personal stuff, right? And like, here's some resources if you feel like you need them, right? We wanted to be able, especially we're talking about a study that's, looking at the impact of our mental health. It was really important for us to have this very tangible, live, accessible, really calming presence, that Chanel was able to provide through peer support. So we had those 4 focus groups, completed 3 in person, 1 virtual, for 37 participants. And you'll see the breakdown here again, the location, the date, and the participants. We had 8 in Bryan, 8 in Weatherford, 10 in Austin, and then we had a pretty good turnout on our Zoom meeting. So for a total of 37 participants. And I think I'm going to turn it over to Benika.
Thank you.
Yeah.
So just to get into our preliminary findings, our first preliminary finding really speaks to how we define disasters. Study participants were exposed to a variety of hazards, as you can see on the table here, table 2. And many of these hazards have been reviewed in existing disaster literature relating to prisons and incarcerated people. So including extreme temperatures, flooding, hurricanes, tornadoes, winter storms. In addition, participants described additional hazards as important to address in terms of protecting their physical and mental health, including ongoing mental health crises, sexual violence, interpersonal violence. And it was really important finding that when discussing disasters, incarcerated participants described hazards more broadly in terms of the unique threats within the carceral environment that threaten their health and safety. Additional preliminary findings included incarcerated people's loss of autonomy intensifies during disasters. And this really speaks to both participants' limited ability to take protective actions, as well as their limited access to hazard risk information. So for example, during the winter storm Uri in 2021, participants described being left to suffer the life-threatening cold without support or care from the prison system. So a quote from one of our participants here. So they cut the TVs off, they cut the phones off, and we packed up with our chain bags and we sat there for hours and we're just waiting and we're not knowing. And we are not seeing the news and we see the weather is ugly outside. We also had findings that talked about abandonment and neglect, as well as the gender dehumanization of trauma, where women talked about being evacuated to a men's unit. And then the men were everywhere. They brought us down the halls and told them to turn around, and they didn't. It was awful. We were there for 4 days. It was Rita. The hurricane hit Louisiana. So when we talk about public health implications, there are several public health implications discussed, but for the purposes of today's presentation, we will mention 3. And the first public health implication is the need for mental health support services before, during, and after disasters. The stresses and trauma that incarcerated women experience during acute disasters are compounded by the daily acts of negligence and violence they are subjected to during their confinement. So similar to before, we talked about the sexual violence and interpersonal violence oftentimes experienced. These compounded traumas exacerbate known pre-existing physical and mental health conditions and lead to long-term psychological distress. So some of the conversations we had really talked about the mental health implications, not only during incarceration, but that continued post-release. The second public health implication is regarding lack of risk communication with incarcerated people during disasters. Incarcerated individuals are often isolated from critical information that can be life-saving in times of disaster or crises. And this includes regular communication from prison staff to provide timely and accurate information and updates about the nature and severity of the disasters. But it also talks about access to external communications. So for example, really being able to communicate with family and loved ones, which is really crucial as it can provide emotional support, social cohesion, and additional safety information, not only for them, but also to really have an understanding of what their loved ones are experiencing during times of disaster. And not having this information leads to, additional anxiety, stress, and trauma. And lastly, incarcerated people are denied opportunities to protect themselves and others during hazard events and are often punished for doing so. So incarcerated individuals frequently, lack access to basic protective measures. So things that we think about, such as adequate shelter and have kind of been talked about in previous presentations, access to water, proper sanitation during hazardous events aren't always available to them. And when they attempt to take self-protective actions, such as seeking respite for an opportunity to cool down during extreme heat or sharing resources with other incarcerated individuals, they are often met with punitive responses from facility staff and leadership. This not only undermines their immediate safety and health, but also fosters an environment of fear, anxiety, and mistrust. And despite all of this, our findings show that incarcerated women and gender nonconforming people resist dehumanization and punishment to care for one another, both while incarcerated and upon release, demonstrating their deep resilience and commitment to collective care. And that can really be seen in the role of Lioness in this project and in the work that they do every day. So it is very important that we continue to provide collaborative efforts between public health, emergency management, corrections, healthcare, and other partners to make sure that they have access to proper plans, as well as risk communication tools to ensure the safety, both mental and physical health of incarcerated individuals. And I just want to take some time to acknowledge Lioness from A&M. This has been a wonderful partnership, and I'm glad that we have the opportunity to continue to work with you all. Thank you to BV CASA and the other facilities who allowed participation. And a big thank you to the participants who shared their stories with us. Thank you to our wonderful graduate students, Tykira and Zilla, and a huge thank you to Jennifer Toon and Marcy from our Lioness team. Thank you.
Thank you both for sharing about your project. So we are now going to, 1 second, let me just unpin you both. Now we're gonna turn over to our Q&A section of today's webinar. And so I encourage people to either unmute themselves to ask a question of any of the presentations they just heard, or alternatively, if you'd rather put your question into the chat, I'm happy to read aloud. And Robin, I do see that you wanted to make a comment. So why don't, before we jump into Q&A, would you like to say a few words?
Good afternoon again. I just, my team and I are just astounded at the types of questions that you're asking, the commitment, the level of quality of work, the applicability, the importance and value to the community. We are just astounded. Every year the work gets better. The implications are so on point and just more and more important as we get more and more exposed to disasters going forward. And so I just wanted to speak another word of gratitude to everybody. We sit in chairs where, we have to make, multi-million-dollar decisions. And with this program, we're making $50,000 decisions that are way beyond, what we're getting from many of these large contracts. I want to encourage you as you continue with your careers to maintain the passion and do this work as efficiently and effectively as you possibly can. As you advance, more money comes to you and people use it for other things. Please use it for this really important research. It has this, huge implications and is so meaningful to these populations that don't get touched by research. It just, it's just so motivating to us, and we're just incredibly grateful, and just hope that, you can continue this moving forward in very difficult careers. It's like being the social worker of science, just underpaid and underappreciated, but we really, really appreciate this work. And I just, just so pleased and proud of everybody. So thank you.
Thank you so much, Robin. So if there are any questions, I encourage anyone to ask them. If not, I have a couple of questions prepared as well. So this was a question I had for all groups. Seeing as the emphasis for the special call was really on research that involved community-based partnerships, I was hoping that each of the groups could kind of share how they came about partnering with their organizations, whether this was, they'd previously worked with them or they had shared interests in the research project. I'm just curious to hearing from, the researchers how their partnerships with the community-based organizations came about.
I can go first. I think Jennifer kind of touched on it in our presentation, but myself and Dr. Carly Purdom had been doing some work around extreme temperatures, extreme heat here in Texas and its impact on incarcerated individuals, and met Marcy and Jennifer through that work. And I think we had talked for a while about, like, at some point in the future partnering. And then when this call came, we just kind of felt like this was the perfect moment to continue our work. And we got together, and again, our work is guided by Lioness. So asking them what are the issues that are currently impacting incarcerated women, what are some of the issues that Lioness is currently focusing on, and kind of taking their lead in the work. And it has led to this project, which we hope to continue to work on, but also several other projects that we hope to get started in the future. And it really, for us, has led to a long-term partnership. And we see them as research collaborators, no longer just, our community partner. But the research was split equally, and they've contributed just as much to the process.
I'm happy to go next. We had a mutual colleague and friend. So I'm part of the board of advisors for another nonprofit called Project Camp that sets up pop-up camps for areas that have been affected by disaster so that kids can be kids and adults can go and do adult stuff. And when this call came out, we were looking for a partner, and I turned to Project Camp and they said, oh, you have to work with Happy Camp. They would be great. And that's how that collaboration came about. And to echo Benika, they really have been equal partners, and we have already started discussing kind of our next steps, because it seems the work is just beginning and there's so much left to do, and we don't want to just come in and then leave with remaining questions. The research has just generated even more questions. And so we are looking forward to continuing the collaboration and really shining a light on this important topic.
I can talk about the Montana team. I mentioned briefly in the presentation that we went to the county to ask what they would like when we saw the call come out. And the reason we were able to do that is because we had some existing relationships, right? Like, we were a known entity. We'd been collaborating and offering support, whether as researchers or serving on community boards and so forth. And so we found that the opportunity to connect with our community partners, it was pretty easy for us, just to be, not to sound like, oh, we're so great, but because we already were members of the community, it was easy to go and sort of ping and see what would be helpful. One of the unexpected partnerships that came out of this, in my opinion, and this is my opinion, my colleagues on the call might feel differently, is that the project also opened up different collaborations for us in our university that we wouldn't necessarily have otherwise had. We had existing relationships with the School of Health, but we've ended up connected in with some folks that are doing work that we wouldn't have otherwise seen as the people we go knock on the door of. But now we're all working together to sort of build out this project to be more valuable. How can we design a public facing dashboard that the community can use, that isn't owned by the university, that's hosted publicly for members of the community? So we started with going to ask what you wanted, and then being able to deliver it to the county was the way that we were successful.
Yes, I would like to briefly talk about how my co-author, did I interrupt? How my co-author and I established those connections with refugee serving organizations. About 2 years before we launched this project, we have been working closely with the Refugee Language Project and the Catholic Charities of Texas Panhandle in the Amarillo. In particular, my co-author Ming Xie has been a very active volunteer at the Catholic Charities and the Refugee Language Project. So she has established very good personal connections with refugees and the staff members at those organizations. So when we went ahead to collect data, we did not only use it as a chance to collect data, but we also, because we gave participants a Walmart gift card as a compensation for participation in our study. In fact, those refugee serving organizations used our research project as an incentive to motivate refugees to attend their cultural orientation workshops. So we on one hand, we have been constantly offering cultural orientation workshops. In this way, refugees could obtain a lot of information they need, not limited to those disaster management, but also related to like workplace violence, domestic violence, and personal hygiene, other topics. And on the other hand, we view it as a good chance to be connected with those people too. So we will keep connecting with those organizations and individual refugees in the future and learn about their needs. And in fact, when we did our study, it's not included in our research findings because we did not ask this research question. But we found that many refugees wanted more support, more language support. So we shared their concerns with those refugee serving organizations right away. So they are making some immediate changes right away. So I believe this kind of relationship is mutually beneficial and it will empower both of us. Thank you.
And I think our PI, Paul Monahan, is going to take this one for our team.
Hey, everybody, Paul Monahan. I'm at the University of Florida, and we've got our partners are actually on this call from the Rural Women's Health Project and the Farm Worker Association of Florida, so they might have some insight too. But I've worked with both organizations for a long time, so kind of had a long-term and pretty good relationship. But nevertheless, I think we spent a lot of time in discussion before applying for this grant and, you know, kind of making sure that the work was going to benefit, you know, their needs and kind of be shaped by their priorities. And so in a way that kind of really kept us honest. They did not want another report that would just be on the shelf. They wanted, you know, an effort that would, you know, start some momentum, kind of networking among these groups that would lead to, you know, some better outcomes in the future. And I've got to give credit to the Natural Hazard Center, the funding mechanism, and being able to share funds from a grant directly with our community partners is huge. And so I don't know if my partners have anything to add to that, but we really appreciate the center for funding this research. And we've really enjoyed it. And I think our partners believe that we're going to continue working together on these issues in the future, looking at other grants and things like that.
Great, thank you so much. Well, we're almost at time, so I don't know if we have really any more time for questions, but I wanted to just take a moment and say thank you all for all the work you've done, for presenting today. We're so excited for all the reports to be published online, and please do, we encourage you to share them with your networks. Because really the projects are so diverse, so interesting, and really impactful, as you've all kind of described, really led and driven by your community partnerships. And so thank you all for all that you do. And we hope to be able to work with you in the future in other capacities.
Go ahead and get started. Federico, you have your presentation ready, I think, so you can go ahead and share your screen. And then you will have your 12 minutes to go.
Got to the wrong one.
Great. No, it's perfect.
Is that it?
Yeah. Oh, you just turned it off.
Okay.
Go back to where you were in the book. There you go. All right. Okay. Go ahead, Federico.
Okay. First of all, thanks to my wonderful team, the best group of researchers I've ever worked with in my many years of academic life. Sandra Fabregas, Miriam Samodesti, and Gary Krebs. And then we had the previous award that looked at news media and government officials during Hurricane Fiona in Puerto Rico and Florida, respectively. We learned about the needs of the communication needs and challenges in those places, but the nitty-gritty was really at the municipal level, where we then got the continuation grant and went on to assess the municipal emergency management offices. And that's where we learned about their policies and practice, about the most vulnerable populations, responding to local authorities. And I don't know why it's not going to the next screen. Here we are. And I'm having to move things around to see them. We assessed the risk communication practices that contributed to community resilience.
I think you skipped I think you skipped one of the.
Yeah, the problem is that this computer is, yeah, here. This is, of course, I did skip that. We looked at 6 inland municipalities, they're listed there, and 6 coastal municipalities. And they each have particular characteristics, but that was important to make sure that we had this coverage of both types of municipalities. And the keys for selecting this, the variables that we decided to look at for selecting these communities were the socioeconomic disadvantages, the proportion of all older adults, all of these things that are listed here. And these indices were quite similar across the different municipalities. Of course, the high flood risk in terms of mountain versus coastal communities that were distinct. And I am having this difficulty with this slideshow, but these were the 2 questions that we had for them. What are the risk communication policies and practices they used? And the most pressing needs and challenges of the municipal emergency management officials to improve their risk communication policies and practices, especially for their most vulnerable populations. We did, these were our samples, the emergency management officials, the procedures was mixed and targeted open-ended questions and interviews. It was a challenge to get them, but we got them. We interviewed them all via Zoom, and we asked for their procedure manuals and other data that we could use for our work. This is taking me to, this slideshow is playing games with me. Here, preliminary findings. These memo officials don't follow policies and practices of the central government's emergency plans. They do, but not all of them, but they do tailor their plans to specific realities and needs. They recognize the vulnerable populations have limited access to the internet, yet they rely heavily on social media for their risk and health communication practices. There's a lack of uniformity in emergency contact information, and they depend on other municipal offices, the Citizens Assistance Office, for information to contact citizens with special needs and challenges. They all need more personnel. The information is carried out from the mayor's office, communication office, not necessarily the memos, the municipal emergency management offices. And when asked about risk communication, their perspectives was more about crisis communication. So they deal with more when there's a crisis than the risk issues that are not necessarily the same. These memo directors are appointed by the mayors, and they are political positions, not necessarily career positions, nor of people who are absolutely well-trained to do the job. Some of these memo directors have other jobs that may or may not interfere with their emergency management duties, but there's sometimes conflicts of interest. We're dealing with communicative vulnerabilities, factors that make older populations more vulnerable to negative health effects during disasters due to that lack of communication or limited communication. There has to be an effort to reduce the social disparities and access to health services. There's a problem with the vulnerabilities associated with people who are very isolated, are economically limited, with disadvantaged communities that contributes to their increased vulnerability. What happens outside of the central part of the communities is unknown in many occasions. there's a need to develop urgent, competent risk and health communication that it can effectively safeguard the care and services for especially these vulnerable populations. We are most appreciative to the Natural Hazard Center, all the staff that we mentioned in that slide, and all of the people who provided us the information and support to make this project possible. That's it.
Great, thank you, Federico. I know you were having some problems. We actually have a little bit of extra time, so if there was anything that you skipped over that you wanted to go over before we move on to Eileen, you can go ahead and add that.
Mirza, Gary, Sandra, do you want to say something that I may have overlooked in this?
Okay.
No, I think you mostly covered it. It was like an overall, we found that risk communication and especially the vulnerable populations, they don't have most municipalities. They depend on this other office. They don't have direct communication with the communities. So we found we had the opportunity to present our recommendations, our results and our recommendations, not only to the central emergency management offices, but to they had this convention where they came from different municipalities, and we had the opportunity to talk to them about it. They're really interested in these recommendations because they have their access to, for example, they use their social media, and they told us that they know that the people have very limited access to internet. And so we had I think we had a good communication with all the officers, and they were very interested. So I think we're gonna keep maybe working with them in our recommendations for risk communication.
There's one thing that I did forget that is important to mention. Their websites are so disparate. They're so different. They don't have even their social media that they depend on and they use. Some of them are on Facebook. Some of them are in other places. They're not managed properly. They don't have the same information. And even the telephone lines can be a person's cell phone that changes overnight, and then there's no access to know how to reach these people in moments of risk or crisis communication or health issues that come along.
Great, thank you, Federico. Thank you, Mirelsa. Okay, Eileen, I think you're next up. You're feeling, go ahead and share your screen. And I think you're on mute still too, so come off mute when you have a chance up there. Great, it looks great. Thank you.
Okay, so hello to everybody. I'm Eileen Segarra, presenting the project Enhancing Disaster Resilience and Support for Vulnerable Puerto Rican Students. My colleagues are Indira Luciano Montalvo, Hilda Rivera Rodriguez, and Silvia Martinez Mejia. In our previous study, we focused on the impact of a school interruption due to hazard event on academic outcomes, and we did find from the quantitative analysis that the duration and severity of interruption correlate with adverse academic effect, but also from the qualitative analysis, we were able to identify different sources of vulnerabilities, including socioeconomic status, disability, living in high-risk areas, or being cared for by grandparents. We also identified the crucial role that neighboring communities, NGO, and municipal government had on the recovery process after the hazard event, and also the decline in the emotional health of the school community members throughout these cascading events. Our current study looked at whether schools have adequately addressed the needs of the student population and looked for insight into effective emergency response measures. We focused on 3 research questions. One was, what practices or programs have the school implemented to address the academic and the social-emotional gaps created as a consequence of the hazard event? Whether they have a specific programs or services directed to the most vulnerable students, and what measures have the school taken to increase their capacity to deliver service to students during emergencies. This is a qualitative analysis. We visited 2 schools. In each of these schools, we conducted a focus group with students. We interviewed the school principal, we interviewed one of the teachers, we interviewed one of the social workers, and in one of the schools, we were also able to interview the school psychologist. We first look at the perception of the staff. In terms of academic performance, they identified the COVID pandemic as the event that had the most significant impact. And the way they are addressing this academic lag is by focusing on individualized attention and teaching for the students. They stress the importance of maintaining a small class size so they can be able to provide that individual attention. And they also mentioned that they have increased hiring substitute teachers to support those academic efforts. When coming to limitations, they mentioned both the physical and technological infrastructure as inadequate and being one of the main limitations to offer services to students. And from the staff perspective, they also perceive deficiencies in terms of parental support and student motivation. With regard to the socio-emotional development of the students, that's where the staff say that most students exhibit some form of social-emotional issue, may be decreased interest in academic, increased substance abuse, cell phone addiction, a heightened sense of impunity, lower levels of maturities compared to previous cohort, and evidence of post-traumatic stress. One thing that the Department of Education in Puerto Rico did is that they hired school psychologists basically for all the schools, and that have proven to be an important addition. The school staff also mentioned that it was really crucial to foster collaboration and teamwork among the different members of that support staff, including the social worker, the psychology, the principal, the counselor. But they mentioned that even with the addition of the school psychologists, the resources they have are not enough to tackle the severity of the social-emotional problems among the student population. Other limitations that they mentioned was lack of access to mental health services in many areas, especially for children and adolescents. They also mentioned that with the resources they have been able to address specific needs of specific students in a case-by-case basis, like the most critical cases, but they recognize that there's a need to offer group interventions for the whole student population, given that the social-emotional problems are so widespread, but they don't have the resources to do those group interventions. One thing that have complicated also the provision of services is that during the recovery process, many schools have resorted to half-day schedules, what they call the interlocking. So maybe for a few semesters, some schools for years have been in half-day schedule, which means that they don't have enough time to develop student social skills, and they also don't have enough time to group activities. They also mentioned that schools do not have resources to tend to the staff emotional and mental health needs that has also been affected by the event. When we look at the student perception, the first thing we notice is that the only educational intervention that the student recognized has been offered to attend to their academic lacks is tutoring. In terms of social-emotional development, they identify their peers as a significant source of support, and also the school psychologists. They also mention the positive effects of talking to their teachers and maybe some activities that the teachers do in the classroom. And some of them also mentioned services from the Puerto Rico Administration of Mental Health and Substance Abuse Services. The student also recognized the COVID pandemic as the most impactful event, but in terms of the social-emotional development due to the isolation that it created. Another aspect that the student emphasized was the lack of adequate infrastructure. So a student said that they felt humiliated, and that's the word that they use, humiliated, by attending school in suboptimal conditions due to the lack of adequate maintenance and attention to infrastructure. As one of the students said, which is in the blue rectangle, expressed it is humiliating that we're going through. What are we going through? Because if the school had been given proper maintenance, its demolition could have not been prevented. So the student feel that the system is really not hurting them, and they feel underserved by the school system, and that also produce a lack of enthusiasm and motivation. When we contrast the staff perception and the student perception, one thing that we found is that the students are not really aware of the strategy that the staff is using to attend to their academic needs and their learning gaps, which mean that the school staff is not really effectively communicating those strategies to the student or the parents. And even more, it means that the families and the student have not been included in the process of designing those strategies during the recovery process. So as a result, we have a student that perceives that there's an absence of government attention to their need, and that causes a general sense of hopelessness. Another aspect where we see a disruption between the perception of the school staff and the student have to do with the effect of the lack of adequate infrastructure. The staff mentioned that the lack of adequate infrastructure was affecting their capacity to provide academic services. And they also mentioned the lack of motivation between the students, among the students, but they don't establish a connection between the two. When we talked to the student, it was really clear that one of the aspects promoting that lack of motivation was the suboptimal conditions of the schools. In terms of programs directed towards the most vulnerable students, when the interviewees identified the vulnerabilities, they were really similar to the one that we have identified in our previous research, except that they emphasize more the role of non-traditional family structure. Due to migration, many students are living either with their grandparents, other relatives, and many even with non-relative, and that has changed household dynamics and resources. In terms of specific activities, they do mention activities integrating students from the regular curriculum and the special education programs as a kind of activity that is helping in development, the social emotional development, and also in development civic awareness among the student population. Nonetheless, social workers are advocating for the establishment of comprehensive special education centers, given that many of the families do not have access to services in their area. They also mentioned kind of like a sideline that the special education program have been reconceptualized, now more directed toward assuring every student a way to get a diploma, but that hasn't been evaluated. It's been really recent. But overall, basically the way that the staff is attending the need of the special education student is the same way that they're attending the need of the whole student population through individual attention, with give them the flexibility then to adapt to the student specific needs. However, we have to recognize that that approach will require more time and resources investment for it to be successful. With regard to the school capacity to provide services in future emergency, there was a general perception that the staff have acquired some knowledge through previous experiences, and that made them a little better prepared than they were before. Nevertheless, they said that the physical and technological infrastructure limitations are really curtailing the school capacity to attend to future emergencies, not only because of the deterioration of the infrastructure due to the different events, but also to the lack of investment in maintenance and the lack of investment in the replacement of technological infrastructure. And another aspect that was mentioned is that student overall emotional health have been weakened, and that reduces their ability to cope with future emergencies. That takes us to the public health implications. What we see is that the adolescent and children mental health crisis that have been discussed globally in Puerto Rico is being exacerbated by the hazard events and also by the economic downturn. So the school staff is really concerned that what we have is a student population with high levels of stress, really frustrated, unmotivated, with low levels of maturity and capacity to respond to this hazard. And that then brings us to the need to allocate resources to school to prioritize student emotional health, and specifically through programs that include group therapy, socialization activities, so they can address the need of the whole student population and not only the most critical cases. And we have to recognize that the schools are in an ideal position to offer services to children and adolescents because of the direct access they have to them. So that will be, we believe, the most effective place to offer the services. We also recognize that addressing the lack of motivation and the low expectations towards the future that many of the students show needs not only programs at the school, but also to creating a support network that include the school community, the family, and the broader community overall. But once again, we believe that the schools are in a privileged position to serve as a community liaison and help create the social capital needed and those support networks. So with that, we want to thank the National Hazard Center for all the funding and the support. And we also really want to extend our gratitude to the schools that welcome us to be able to do our research.
Thank you so much, Eileen. We are actually really running ahead of schedule. I think this is like the first time in the history of webinars. So if anyone would like to kind of extend your comments out, if there's something you felt like you raced over, go ahead and keep talking. Mary and Jesse will give you a little bit of extra time too, so you don't feel like you have to race through. And I also have not been doing my job. I have not been putting the wonderful, the links to all the reports in the chat. So I will be putting the links to the reports and the briefs in the chat as we go forward. I'll do Federico's and Eileen's first. But and Eileen, unless you have a little bit more you want to say before I move on, go ahead.
Maybe highlight 2 points. One have to do with, we're really concerned about the social emotional state of the student population in Puerto Rico. I think that's a critical issue that needs to be addressed, and I don't think it's been talked about enough. And the other thing is that when we see the disconnection between some of the student perception and some of the staff perception, we also see the need to strengthen social capital within the school communities.
Great.
I don't know if Indira and Hilda have anything.
We will come. Thank you, Eileen. We'll come back at the end and have more discussion so others can ask questions. But yes, Eileen's report is excellent, and I'm going to put the link in there right now. Everyone should go check it out, and also their previous research over the last 4 years, right, Eileen? I think that you've been working with us. There's amazing work going on there. Okay, Mary, we're heading to you now to present on your team's project. Thank you.
Hi, hold on, let me just share my screen. All right, does that look good and can you hear me?
Yes.
Okay, amazing. Oh, wonderful. Thank you. Hi, everyone. And thank you, Federico and Eileen, for your continued work as well. And thank you, Dr. Morty, for your great introduction. My name is Mary Angelica Painter, and I'm a research associate at the Natural Hazard Center. I know Dr. Morty earlier had mentioned Anais would give the presentation, but just to highlight her dedication to this project as the principal investigator, she's actually not here because her and Anid and Edna, Fernando Cuervos, and our project manager, Javier, are actually on the ground right now implementing these projects. I will be there next week to help with that and hosting a community event. So this project is definitely still ongoing. It's continual, and our relationship with the community is strong. I'm also joined today by Fernando Tormosa Ponte, who's also one of our co-PIs, who can hopefully help me answer some questions or fill any gaps I may have missed, because Spanish is my second language, and this entire project has been done in Spanish with the community. So thank you for being here, Fernando. So our project is centered on conducting what is called a participatory budgeting project, which is a community-led intervention around making a democratic decision on how funds should be spent towards projects for community resiliency and public health. So this builds off our previous 2 awards. So this is actually our 3rd award. Our first call, we explored the relationship between social capital, and thank you for introducing that concept, Eileen, community health resilience and compounding hazards in Corcovado, Puerto Rico through mapping of the community's assets and resources and really bringing the community back together. This meeting of our mapping exercise and doing this project was actually the first time the community leaders had gotten together since the onset of the COVID-19 pandemic. Our next phase of the project, we developed a community-centered survey for Corcovado, which was meant to be used by local community leaders and local public health officials to understand food, energy, and water insecurity, public health risks, and other dimensions of risk during, before, and after natural hazards. So really a tool for the community to use to better know their members and their needs during the disaster cycle. And our research team was motivated by both of these projects to implement something that gave direct resources to the community, but that is decided by the community about their specific needs in the context of natural hazards and disasters. So the purpose of our continuation award was to carry out this project to the community and lead to implementation of at least 3 community-based projects, which I just mentioned before are being implemented right now. And these projects were meant to combat food, energy, and water insecurity or mitigate these public health risks, as was mentioned. We hoped that this project will help researchers and practitioners alike understand and apply some newer types of mitigation measures for things like compounding hazards in the context of public health, but also enhance that public engagement and really create stronger social connection between members of the community. So our project and all of our previous projects have taken place in Corcovado, which is in Añasco in West Puerto Rico, as you can see from this map. It's a small mountain town with a large elderly population and is quite rural from other parts of the island. Our timeline consisted of many different steps, building many different teams, including establishing our own research team, and then having a steering committee that is made up of community members and leaders that would also help with this project. We also had different steps of collecting proposals for how to spend the community budget, and the community vote to decide on which proposals are best were decided by the community. And now we're in the phase of like implementing these projects, hosting a community vet, and we're kind of a little more towards the tail end of the project. Our community partners are members of the Corcovado community. We've built a strong relationship with these community members over the past 3 years. And we were able to establish these relationships through other local connections with members of the community and our research team. Some of our community partners, such as Edna Torres, Anid Quintana, and Fernando Cuervos, are also co-PIs. Javier Torres, who's our project coordinator, has been completely invaluable to this project, and he is also on the ground in the community as well. So as mentioned before in some of our timelines, we had this kind of step process of completing the community participatory budget project. So our research team, which you saw the names listed at the start of the slide, essentially needed to establish a steering committee that was made from community members. So we used some local connections to establish a steering committee that is made up of, I believe, 6 or 7 community members. And what the steering committee, along with help from the research team, was to promote proposal solicitation to the community. So community members had an opportunity to basically fill out an application or a proposal for how they saw the money to be spent. And we put very limited boundaries on that. So it had to deal with food, water, energy, public health, something around compounding risk, but we really didn't set stronger limitations around that. Once we gathered the proposals, we had around 46 proposals submitted by the community, and for a community of 600 people, that seemed like quite a lot. So we gathered the community proposals. There were some overlap, so we ended up merging some of them. Some of them weren't really feasible due to being like, that's kind of a government thing to do, or like the money resources would not be able to fix that certain problem. So we kind of did some workshopping with the steering committee of narrowing down the proposals for those that were feasible and merging those that were very similar to one another. And then we hosted a vote in the community. We did this through either an online form, or we went to the church, the community center, and other places throughout the community to solicit paper votes as well, very much on the ground to engage members in this project. And then we have since announced the winners of the proposals, which I'll get into in a minute. And now we're in the implementation process, and then we'll be holding a community event closer to the end of this month. So some of the results, so with the community votes and the proposals that were submitted, the number one was actually to install security cameras. That was followed by solar street lights, workshop series on being prepared for disasters and other such topics. And so those are the three that we are currently planning on funding, but we do have some wiggle room in the budget, and if there's more, we will start implementing some of the fourth and beyond place projects. So things like health clinics, purchasing non-perishable food to stock for times of disaster, first aid supplies, repairing recreational areas for places to convene during things like evacuation or other sorts of crises, education on solar panels and other green energy, and also a community garden. So if we have other funds that come in, we will also support these other projects. So we found that our project overall, as like a impact of the community, activated community participation from Corcovado community members every stage of the process. So as said before, we got 46 proposals submitted. Our steering committee has been incredibly active and involved in the process. We also had almost 200 people vote. So we had about 20%, or maybe even more than that, of the community vote and participate in the voting process of the project. And we expect that as these projects are being implemented, there will be more opportunities for community members to work together on these projects, be educated about these topics, interact with each other, and really hopefully build some like social connections with one another. The participatory budget exercise supports a community-led intervention. So really centering the community, considering the history with hazards and disasters. We hope these implementation of these projects will support community resiliency in future events. And there was also a sense of feeling, especially coming from community leaders and especially in the steering committee, that these proposed ideas and the implementation are really owned by the community, and it's their opportunity to actually engage and take agency in their decision making throughout, not just in this project, but continuing that feeling going forward. We also created, as many of our previous projects, we have created a tool, an application that goes along with this award. Our previous projects, we had a mapping tool, a community survey, and we had these different materials. So we ended up developing a website, which you can see on the screen here. For this phase, we developed a participatory budget template that can be shared with people who are interested in conducting a similar project, pulling some lessons learned from our own that you can see on our report website as well. And so here's our lessons learned as far as translating research into practice. So first, we found that having deep connections with the community is essential for ensuring that engagement and participation from community members actually happens. So our years-long relationship with the community and having members of the community be a part of our teams, both in the steering committee and on the research team, really helped to ensure that this project ran smoothly and that there was sufficient participation for it to feel like a true democratic process, a true community decision being made on these implemented projects. Second, that as members of the research team, we're actually from various disciplines, different backgrounds. And so we had to acknowledge that we had our own perceptions of what we believe would be beneficial to the community. And so we've had to do some positionality, some reflexivity tasks as a team, and hopefully we'll do more of those going forward, as that has been a topic of discussions of like what we would do versus like what the community had decided. And the third is that we found that having several different avenues for communicating, so going to the places where people pay for their water utilities, going to church, going to community events, having an online forum, that all of these different ways of communicating with residents really elicit the excitement and drive for participation because they could choose to engage with the project in their own way. And we did a lot of coming to you. So that really excited and ignited participation because we made it easy for participation to happen. So with that, we have extended great gratitude to the Corcovado community, the entire research team, our project manager, Javier, again, cannot stress enough how much he's been integral to our project. And yeah, thank you all for being here and for the CDC and the Natural Hazards Center for supporting this project.
Thank you, Mary. That was wonderful. Please, you can access Mary and Anais's brief in the chat. I put the link to their brief there. We're going to now go to Jessie Palma, who is going to present for her team about planning Resilience Hub with tribal government in Virginia. Go ahead, Jessie.
Hi, everyone. How are you doing? I'm going to go ahead and share my screen here. Okay, so again, talking about planning a resilience hub with a tribal government in Virginia, co-producing the hub planning process and resource guides. Project overview, I wanted to start with a description of a resilience hub in case anyone's not fully familiar. That's a resilience hub is a multifunctional community center offering social and educational services while serving as an emergency shelter during hazardous events where residents can find supplies and vital communication. Our previous award report was involved us working with 2 different tribal communities and adapting our resilience adaptation feasibility tool assessment process to accommodate. This process is typically used for localities. So we tried to and successfully accommodated that assessment process for the unique cultural and administrative attributes of the participating tribal communities. We then took that assessment process or the results from that assessment and co-produced a resilience action checklist of implementation goals. We then developed an integration model for resilience building and resource leveraging. And by doing that, we identified the Resilience Hub concept as a culturally adaptable strategy for leveraging resources and implementing those multiple of those resilience action checklist goals. So those implementation goals. For the continuation award, we outlined a resilience hub planning process and implementation strategies that align with tribal government structures, increase community awareness of resilience hub planning and hazard mitigation opportunities. We were focused on developing 2 deliverable products to inform and facilitate resilience hub planning in a tribal community context. So that is the story map on Resilience Hub design concepts, and then there was an additional funding resource guide. And then we also co-produced those deliverable products. That was a major focus as well to ensure cultural competency and usability, really. For the project site, we were at the Mattaponi Indian Tribe and Reservation. To clarify, for the initial award, we worked with 2 tribes. For the continuation, we just had 1 tribe that chose to participate in that. So that was the Mattaponi Indian Tribe and Reservation that's located on Virginia's Middle Peninsula along the Mattaponi River. And this is just a thumbnail of the location. You can see it's pretty close. I think I want to say maybe 50 to 60 miles from the Chesapeake Bay mouth. And then there's another picture of the Mattaponi River. And this is actually taken at the reservation. The structure to the right there is part of their hatchery and marine science center that they have on the reservation. And I have a very abbreviated timeline here simply because I have a much more detailed one in a later slide. So we began the initial research project in February of 2023. Then we began the continuation project, the community engagement, in November of 2023. December is when we started recruiting members for our planning committee. And February, we held the community engagement workshop. And in March, we were able to refine and deliver a lot of those goals. So for our, our community partners, it was a big factor working with a tribal liaison who is also their environmental staff member, which was chosen by the chief. We also worked with 10 planning committee members that were chosen by the liaison, including tribal council members, tribal staff members, traditional ecological knowledge holders, local citizens. There are a lot of citizens in different locations. The population there at the reservation is pretty small. And then, of course, the tribal chief. And we also invited subject matter experts from the research team's respective universities relating to different topics in health ecosystems, geospatial, and engineering professions. So it really, as we approach different concepts and ideas, we sort of invited people that were relative to that. And the picture here is from the powwow that I was lucky enough to attend back in June. So for our project activities, we had 4 main project activities. The first were the strategy meetings. We held 5 of those. There were 1-hour-long meetings that included the research team, the liaison, and any number of those relevant subject matter experts that I just mentioned. Then in those meetings, we worked on things like developing the planning committee recruitment plan, timeline and format planning for the workshop, agenda settings, and of course, presentations from subject matter experts. Our second big project activity was forming the planning committee. There were 10 members from various aspects of the community, and they were recruited and initially engaged by the liaison to assess capacity and understanding of tribal resilience without the research team to ensure privacy of proprietary information, which is a big concern. So our third major project activity was planning the workshop. Obviously, that was a 1-hour long, or I'm sorry, we had 1 2-hour-long planning workshop that included the research team, liaison, and planning committee members. At that planning workshop, we reviewed previous resilience assessment findings and priorities that were those things that were identified during our initial research project. We also collected planning committee input on resilience hub development needs and capacity, identified and established hub priorities and action items. And for our fourth major activity was, developing and refining those deliverable products. We developed and refined those over a 4-month process that was done by the research team. And again, one of those was a story map, which was intended to be an informational tool to visually demonstrate resilience hub concepts that can be used for educating committee and other community members, including, and it includes planning tools as well. And then we also had the funding resource guide again, which is a collection of various potential funding sources, everything from specific grants that I thought might be applicable to, private contributors and databases. I really tried to include a wide variety of options for them. And so for results and outcomes, so this table it covers a lot of the activities and how we worked all of those out, but it also includes, I wanted to show how the activities, what the outcomes were of each action that we did. So I won't go over these in complete detail, but for the first strategy meeting, it was really sort of talking about what direction we wanted to go with this, and deciding how the recruitment process was going to happen. Because again, that wasn't actually done by us or like by the research team. It was done by the liaison. So it's a lot of planning and communicating there. And our December meeting was when we really started working on this story map. The idea was to develop the story map prior to the workshop. That way we can use the story map in the workshop as an informational tool, and then also get feedback from community members and the planning committee during the workshop, so that I could tweak that later on and make sure that it really had all of the information that they were looking for and needed. Our January meeting, we really started planning the workshop agenda and focusing on funding sources. Then, and in the actual workshop, was able to get a lot of that feedback in February from different people and different ideas. And it was really interesting because there were a lot of ideas being thrown around that I hadn't really thought of. So again, another reason why, that community engagement is so important, because, I thought I had like a really solid list of grant and funding sources, and the brainstorming session totally expanded on that. And again, so then we had another follow-up strategy meeting after the planning workshop, just to kind of talk with the liaison about the overall experience and start refining those deliverable products. And then our final meeting was to ensure that this community engagement brief was reviewed by the liaison and the chief and the council, just to make sure that everyone's okay and on the same page. So for our public health tools, this is a screenshot of the story map, just an example of how it's set up and the kinds of things that could be found there. The Resilience Hub design story map included introductory information on resilience hubs, their purpose, and optional features to include, literature on climate resilience and tribal planning processes, links to various planning toolkits, design guides, training opportunities, and templates for resilience hub planning, and examples and success stories of other existing resilience hubs. And for the funding resource guide, we ended with several options for funding sources, including government grants and potential NGO contributors, and as well as I mentioned before, databases, search tools, and related agencies and entities. And so for lessons learned, first and foremost, again, the importance of working with the tribal liaison to ensure all steps of the project were developed and facilitated in a culturally sensitive manner and in respect of proprietary information. The second was the value of co-production and community engagement in tribal planning processes. Engaging with community members via the planning committee allowed us to refine our deliverable products to address the specific and unique resilience needs of a tribal community. So for example, prioritizing that traditional ecological knowledge and culturally significant sites, that's something that can only be done by tribe members themselves. And third, the need for developing products with formatting and information that can be utilized long-term to support future resilience hub development and maintenance. Toolkits, guides, databases. This was something that Lori had mentioned during our last webinar, and she used the term evergreen, and I love that term. How long how can these products be used in the future going forward? And to be honest with you, that was something that I really kind of struggled with quite a bit, because I did really want this to be something that could be utilized by other groups and other tribes, especially in Virginia, because our RAF team, our partners, we work with lots of different tribes and are looking into doing that more, expanding on that going forward. But at the same time, it was also really important to make sure that these deliverable products were really going to serve their purpose for this group specifically, because their capacity is really limited. I really wanted to offer them some really tangible products. And just the last slide here, I just wanted to show off a couple of pictures that I took at the powwow, and just kind of, you know, the community and just how wonderful these people are. And yeah, our acknowledgements here, and this is a photo of the Hatchery and Marine Science Center that's there on the reservation.
Wonderful. Thank you, Jesse. Thank you for a fantastic presentation. And I love those pictures too. Those are great.
Thank you.
We are now going to have Lauren Clay come and present for us. She has been pioneering some work on a disaster food security scale, and so we're going to hear more about their project. Thank you, Lauren.
Thanks so much. Let me start my presentation and then share. Let's see. Are you looking at?
That's great.
Perfect. Okay. Well, I'm Lauren Clay. I'm a associate professor and chair of the Department of Emergency and Disaster Health Systems at University of Maryland, Baltimore County. I'm going to present on behalf of our team on our project validating the disaster food security scale rural, testing face validity with rural practitioners. Let's see. So in our previous award, we worked to validate the disaster food security scale for rural populations. This was important because to ensure that we're measuring the barriers to food security in rural communities, we needed to do the validation work to ensure that we were capturing those things most relevant for rural populations. Our continuation award. So we originally set out to do additional data collection for racial and ethnic minorities in rural communities to do some validity and reliability in that work. However, we ran into some issues because with sampling. So we wanted to recruit from counties that had had a disaster declaration since 2020. And we, so FEMA does their disaster declaration process at the county level. However, Qualtrics, the survey firm, works at the zip code level to do recruitment. So in the past, we've done surveys by states and our team. And so working with the county level and Qualtrics approach to using zip codes, we've had just a series of challenges that I'll share about just in case anyone's doing survey work in the future. So there's no definitive crosswalk between counties and zip codes that our team is aware of or that Qualtrics has been able to provide. And then while we've been doing sort of the work to match things, we've got a lot of inconsistencies, we have 2,000 counties and, we're having hundreds that aren't matching to any zip codes, things like that. So we continue to work to identify all the relative zip codes, but we decided to change gears with this award while that work is still ongoing. And we might have to just switch our approach so that we're adding a screening question. So still recruiting at the state level with the screening question for county, but then this gets into cost issues if you have too many nested quotas. So it's been a process. Concurrently, we've been looking through more of the data from our previous award. So in that award, we focused on getting feedback. We did some cognitive testing with the disaster food security scale with individuals in rural areas that had experienced disasters. But our team became really interested in getting input from practitioners in rural settings who are seeing, large numbers of people and are working within systems to understand. We wanted to make sure that our data was going to be useful for the people that might be using the data. So we sort of shifted gears with our continuation award from more data collection to more community engaged work. And that is what I'm going to share with you here. So again, research site-wise, we were looking at rural counties in the US. Timeline, we were really looking at any county that had a disaster declaration since 2020. And our research question turned out to be, how well does the DFSS rural address the rural context for diverse populations? And, looking at things like the words in the language in the questions themselves, the concepts we're asking about, as well as population-specific concerns from rural practitioners. So our data collection method was a survey. We're focused on rural practitioners that were doing something related to food access. We received, we sent out to about 50 practitioners that we had in our networks as a team. We got 10 responses. Participants were compensated with a gift card for their time. Survey questions included domains like, are there any concepts missing? Is there confusing or inappropriate language? We asked for suggestions related to concepts and language. We asked for feedback on answer options, not just questions, as well as concerns about comprehension among the populations that the practitioners serve. So what types of rural practitioners did we have? We had nutritionists, people in the education space, farmers, and healthcare professionals working across a range of specialties. And the populations most commonly served by our respondents were older adults, middle-aged adults, and low-income adults, or low-income families. So these are our preliminary findings. I'll just highlight a few things so that, for time's sake. So we did ask, were there any words or concepts that were difficult to understand? The feedback that we got was that health or medical terminology might be hard for some folks to understand. And then a few people commenting on needing the survey in multiple languages. So that was really good to note. You can see from the percentages, JK, there was pretty good agreement amongst our practitioners that completed the survey. Another area where we got good feedback was we asked if there were question or answer options that should be added. Several people commented that transportation is a major barrier in rural areas, and that while the survey does ask about transportation, they suggested more detailed questions to better understand the specifics of the issue. So that was really helpful. And then we asked, excuse me, we asked, would the survey be useful, and if so, how? So we got some important feedback. So several people talked about the importance of the data offering a recent picture, accurate information, and being important for sort of tracking disaster impacts in the community. And then a couple of people talking about how they would use the data specifically to improve services. A couple of people commented how in particular they're relied upon in a post-disaster setting to provide food support. And so that was really great to hear that they thought it was useful for improving services. So implications wise, so certainly having a validated disaster food security scale specifically for rural populations provides that relevant data that we heard was useful for practitioners. And can support increased efficiency and effectiveness of rural emergency food response to disasters. And a validated scale can also provide information about transportation barriers, and thus support improved transportation interventions to improve post-disaster food access. So one of the important reasons for having a disaster food security scale is that if we rely on a non-disaster specific scale, then the only interventions that we really have are monetary interventions, because the only thing that standardized measures like the USDA Household Food Security Module ask about is financial resources for food. So having this disaster food security scale that gets at the diverse barriers that happen after a disaster can really help support a suite of interventions to improve food access in that acute post-disaster setting. So as I said, the work is ongoing. We are going to do our larger sample, but we're going to integrate this feedback from the practitioners, consider what we're asking about related to transportation, and then we'll do that broader data collection to look at racial and ethnic, race and ethnicity within the rural context to make sure that that the scale is validated for those populations as well. I think. There we go. Some acknowledgements. Certainly the research team, the people that of the original disaster food security scale research team and the people that offered feedback on this round, as well as some previous funding for this development. Thanks so much.
Great, thank you, Lauren. That was wonderful and a real example of how to pivot when things don't go as planned, which I'm sure pretty much everyone who's been working on one of these projects has experienced. So we can talk about that more if you have questions for Lauren too about how they managed to kind of come up with a new way to turn their project. All right, so we have actually 17 minutes for discussion. So if anyone would like to just raise their hand, we don't have very many people in this room, so either use the Zoom raise your hand feature or come off of your camera and raise your hand. We can go ahead and get to questions. I'm going to wait a minute, like 20 seconds for anybody to get up the courage to ask a question. Okay, there you go. I see you go. Thank you.
For the schools in Puerto Rico and also for the community, was there any political intervention, feedback, concern, discussion? Because it's Puerto Rico, it's either for most of the developments at the community level and certainly at the educational level, it's whichever party is in power in the area or at the Puerto Rico level in general has a lot of input and intervention in things that are done. Was there any of that in either the school or the Corcovado efforts?
I think that at least at the school level, we know that the system is highly politicized, and that's one of the reasons why we're really careful about keeping confidentiality of the school we visited. But during the discussion, usually they don't enter into the political discussion, but we did found, and I was writing somebody to add something like that in the chat, that in this specific study, they didn't mention, it didn't focus that much on the interaction between the central Department of Education and the schools, but in our previous study, the school staff talk a lot more about that. So there was a lot of discontent at the school level. We was with what was going on at the Department of Education at the central level. So they feel that the Department of Education really didn't understand what was going on at the school level. But they didn't, some mentioned some political comment, but it came more from the discontent they have with what the Department of Education at the central office were doing. One thing I have noticed, for example, the school principals are a lot more careful about what they say than teachers or social workers who tend to be more critical. But even school principals who are usually in their position because they're somehow related, not all of them, but many of them may be related to the governing party, they may be a lot more careful, but they still do some criticism of what's going on and their lack of, we'll say, autonomy to make decisions at the school level.
Thank you, and Eileen. Just to speak to the Corcovado project, and Fernando chime in if I get something incorrect, but I think it's almost the opposite, that there was no political involvement or no government involvement in disaster resiliency. And that's what really was the impetus for the excitement and working in this community through things like our participatory mapping project of the community, to developing the survey for local community members to be able to assess public health risk, to doing the participatory budget project, which from other research projects and literature, we actually know that the way we did the public participatory budget project was actually quite different than in other places in other previous projects, because many of these projects before, the funds come from like a municipal entity. But because of that municipal entity bringing in those funds, there's a lot of restrictions around what that money can do. Like they put up a lot of barriers and make it very like narrow in scope. So yeah, I would say it's for our project, it's almost the opposite. It's the lack of government intervention, a lack of political will to like do things that like caused the excitement around some of this project, all of our projects, and even this one. I don't know if you want to add something, Fernando.
I remember asking this question on the ground, and two things were interesting. One was that there was kind of this like feeling of neglect from local parties and local elected officials, which kind of motivated the self-management work. And the other thing that was interesting was that there was an understanding that there was diversity within the community organization in terms of how they identified themselves, and there was somewhat of an informal agreement to be careful to avoid partisan work because of how it could hurt the community work. So it was really interesting how they were managing that in recognizing that there were some differences there and not really trying to go there.
Thank you.
That's really interesting. I was asking to Eileen at the chat if the issue of centralized education system had come up, partly because of the politicization of our education system. But then again, we would think that if services, especially the education department, was to be broken down into municipalities, but then we probably had the problem we had when in our research that we found that the emergency management office director is a politically appointed position. And when we asked them if they thought that it should be a career position, because some of them hold other positions in the municipality, and few of them, we found out that they are the director, the president of the bid board, municipal bid board, and that presents, a problem because though they adjudicate the bids for the projects. And they said, it was very interesting to us that most of them said that yes, that it should be a career post and not a politically appointed one. But two of them said that it had to be this way because if not, if the municipal emergency management director was from a different party than the mayor, they would withhold services to make the mayor look bad. And that's how politicized everything is here. And that really, we were really surprised about that, but it's true that that sort of thing happens. So I wanted to know, I'm glad that the Corcovado project doesn't have this political involvement, but in the education system, we know for a fact that that sometimes the resources are withheld and they're given to the districts that are in the same are from the same party as the governor. Not in this one. It's always like that.
And just to relate to the conversation, there was a lot of there's a bit of political turmoil going on even within the tribe that I've been working with. And not to speak too much on their personal business, but for a group that already has such a limited capacity and resourcing options, and then to have that thrown in the middle of it, and this is also a tribe that is only state recognized, not federally recognized, so that limits so much funding, so many funding options. And I have to agree with Mary, though, it kind of made this a little more, to be selfish, exciting for me because it was way more grassroots and really kind of getting, down on that level and, looking for private contributors and things like that. And to be honest with you, like going into it, it seemed like such a task, and sort of intimidating, but it really actually ended up being a great, we found a lot of options. And, it was once we had to really get creative and start exploring these, these other options, we just found more and more. So it was definitely enlightening in that respect, and you kind of get, what do they say? Necessity is the mother of invention, right? Or innovation. So definitely had a similar experience there.
Great.
You clapping your hands, Federico. Did you want to add something?
Well, I have other questions, but I don't want to monopolize this because it's just fascinating what I've been hearing. I'm learning so much, and it's so great for what you've all been doing.
That's great. Yeah, no, I think that's just really interesting, the whole like politicization of the process, right? And how that affects how you do your research too, right? And like how you do these application projects it's a wonderful discussion. Does anyone else I have some questions, but before I ask my questions, Eileen, I see you about to raise your hand. Go ahead.
I just think there's an important connection in the experience that they have in Corcovado and the tribal community with the grassroots and what's going on when we look at from the government agency side. Like for me, it's really important to get the school community to organize and empower themselves, because the only way that you can really go against all the political influence is if you have a community that is well organized, if you have a community that is cohesive. So I think that's what we would like to see, is the school community organizing themselves so they can really demand what they need and not be so vulnerable to political influence.
That's a wonderful
Definitely.
point.
I think it was one of the lessons after Maria, for example. Communities learned that they could not wait for the government to help them. They had to organize, and they had a lot of more. What they got from the government, they didn't get anything, or it was too little too late. But the communities organized, and they found that they didn't have to wait for the government to help them. So that's really one of the lessons, I think, for all of us.
And I have to say, to piggyback on that, having worked and doing similar work with localities and then having this opportunity with tribes, I definitely saw more action happening with the tribe. And that's not to say that other groups are not also, focused on action, but having that smaller group and sort of, that enhanced community connection, I think really put the boots on the ground a lot faster. So it was, we were talking about things one day and they were ready to go outside and do it the next day. So that also made it a little bit more exciting. So it's sort of a contrast between like less capacity and less resourcing, but more movement and more action, faster, I guess is the way to say it. So interesting, for sure.
Federico had a question that was also on my list about, especially for Barry and Jesse and Fernando, who are doing these very locally organized, like leveled projects, and that these are designed to create community, empower the communities so that they can then advocate for themselves. Like Eileen is saying, how important it is to organize the community so that they can advocate with their schools and the school district. So Federico was wondering, how did your projects get started? How did you make these initial, were the community groups already there? How did you get involved? So we'll let Fernando and Mary go first. I don't know if you guys want to decide between yourselves who's going to talk, and then we'll have Jesse go.
Maybe Fernando, you can start since I wasn't around until the second phase. So I have an idea of what to say, but I think you might say it better.
Cool. This was a really cool experience because we had a lot of members of our team that were from the community. And then we then not only had researchers from the community involved, we then had community leaders involved in every aspect. Like it was an evolution. It didn't start like that. But this very last phase, they were named contributors in every aspect. The coordination, decision making involves leaders with respect to their current burdens in terms of time. So we did some work to minimize the burdens we were placing on them. But there was an existing relationship from those of us who weren't from the community, because we had Anais, who had done dissertation work and is not far from the community. Anais is from a region of Puerto Rico very near from Corcovado. So it was a years-long process of developing relationships. And, you know, Mary learned Spanish. Like, you know, not everybody does that, right? So I think that was a sign of credibility and commitment. Like, that's a huge investment.
Thank you, Fernando. And just to add on to that, like, maybe this is me being a little woo-woo, but don't underestimate the power of friendship. Ours really came from Anit and Anais were friends and went to college together, and Anit is from Corcovado and her mom is a community leader. And so it really felt like this organic community, like friendship, then family, and then people, you know, and bringing people in and getting them to the table. And so like, if you just have like one good friend, you can spark a whole change in a community together.
Thank you, Mary. That's wonderful. Okay, Jesse, we have 2 minutes left.
Okay, yeah, so actually for this particular group, as I mentioned at the beginning of my presentation, we work typically with localities, and we're sort of branching off into this tribal work. So a couple of the members of the tribe had participated in the work group for an adjacent county that we worked with. So that's how we had the initial contact with them. It was through another project. And then, you know, in going in and working with them, I personally am from, you know, I grew up like maybe 30 minutes away from the reservation. So I felt very connected to that. And, you know, there was a lot of, you know, having mutual friends with people there. So, you know, to go along with what Mary said, you know, just kind of having those common connections and things to, you know, relate on for sure. But this really spawned from a previous project, and someone just happened to be there and wanted to know more and expand that into their tribe.
Thank you, Jesse. Okay, we're actually at the end of time, so I'm going to wrap this up and thank all of you for all of the hard work you have been doing over multiple years, often, like Mary said, many years before you even got your Public Health Award grant. So I know these have been long-term projects. Please keep continuing to share what you are doing with us. We want to hear more, and we are just so thankful for all that you are doing. Thank you again, everyone, and have a great rest of your day.
Bye.